Hello and welcome. This is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. The number of diabetes cases among children has nearly doubled since 2001, according to a new study by the American Medical Association. Those numbers are expected to quadruple by 2050. Spikes for type 2 diabetes were highest among Black and Hispanic children. Some attribute the recent spike to COVID-19 fueled by lockdowns and closed schools, which have reduced access to health care, healthy food and places to exercise. Though type 1 cases are still more prevalent among children and have also increased recently, the rise has not been as sharp as type 2 cases, suggesting practitioners should focus more on prevention, such as diabetes screening at younger ages. And the federal government of Nigeria has informed all civil servants in the country to either get the COVID-19 vaccine or present a negative test result. However, the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shaib, at a press conference in Abuja, made clear that federal civil servants were not under any obligation to take the vaccine. However, they must show negative COVID-19 PCR test. And the lead for the National Prevention of Mother-to-Child Transmission of HIV and AIDS at National AIDS and STI Control has advocated for state government to procure HIV commodities to boost PMTCT. Dr. Benga Ijautola, PMTCT Assistant Director, made the appeal in Calabar on Thursday at a 3-day workshop to reinvigorate and produce a work plan for journalists. According to him, there was an urgent need for a clear community strategy to reach the unreached, as well as to mobilize community influencers, especially religious leaders, who would help to educate pregnant women on PMTCT needs. And according to an update by the Nigeria Center for Disease Control on Thursday, the country recorded 6 deaths with 226 new cases from the coronavirus pandemic across 14 states and the Federal Capital Territory on Thursday. The update reported that the total infection from the coronavirus in the country now stands at 208,630, adding that the death toll has increased to 2,767, and a total of 196,326 Nigerians have been discharged nationwide. The latest data shows that FCT and Plateau states topped the chart with 73 and 34 cases respectively. An expert committee on Thursday recommended a booster dose of Moderna's anti-COVID vaccine in the United States for people with underlying ailments, a month after making a similar decision for the Pfizer shot. The opinion submitted by the advisory committee of the Food and Drug Administration, which composed of researchers, epidemiologists, and infectious disease experts, is not binding, but it is rare for the FDA not to follow it. After a day of debate, the experts decided to authorize a booster dose of Moderna for 3 categories of people: the over 65, people aged between 18 and 64, who are at a higher risk of developing a severe version of the coronavirus, and those whose work may involve frequent exposure to the virus. And this is TOS Television Network. You're watching Health 54. To stay with us. Welcome back. This is Health 54. Health officials in Eastern Democratic Republic of Congo confirmed the second case of Ebola on Thursday and said the latest flare-up of the virus appeared to be linked to the massive 2018 and 2020 outbreak. A 42-year-old woman tested positive in the city of Beni on Wednesday, city health official Michael Tosalisane said. The first confirmed case was a young boy who died of the disease last week. 3 of the boy's neighbors also died in September after experiencing symptoms associated with Ebola, which can include severe vomiting, hemorrhaging, and diarrhea. Also, health experts in Nigeria on Thursday blamed the federal government and citizens for the increase in the number of cholera-related deaths and infections in the country. This is because the death toll in the country hit 3,208 in just 276 days. The latest cholera situation report contained on the NCDC website on Thursday indicated that the shortage of vaccines was affecting intervention efforts in most local government areas, wards and settlements with reported cases of the outbreak. It identified the lack of potable water, especially in some rural areas and urban slums, open defecation in affected communities, inadequate health facility infrastructure, and commodities for management of patients as part of the problems. The United States officials are investigating possible cases of Havana syndrome illness in Colombia days before a visit by the Secretary of State. This is coming as the state on Friday reported a case of the strange disease. It is suspected that the U.S. Embassy staff in Bogota may have been injured by the mysterious illness, which causes a painful sound in the ears, fatigue, and dizziness. Havana syndrome was first reported in Cuba in 2016. However, U.S. diplomats around the world have since reported cases of the syndrome. Its origins are unknown, with some speculating it is a type of weapon. And deaths from tuberculosis have reportedly increased for the first time in a decade as a direct result of the COVID-19 pandemic, the World Health Organization said on Thursday. New data from the UN Health Agency highlighted how years of global progress in tackling the preventable disease have been reversed since the pandemic overwhelmed healthcare systems in 2020, preventing vulnerable people from seeking help. Covering the response to the epidemic in 197 countries and areas, the TB report found that in 2020, some 1.5 million people died from tuberculosis in 2020 and more than 2019. In a worrying development, the World Health Organization noted that the number of people newly diagnosed with the disease fell from 7.1 million in 2019 to 5.8 million in 2020, meaning that far fewer people were diagnosed, treated, or provided with TB preventable treatment compared with 2019 cases. And just before we go, the European Union and South Africa are in intense talks on how to increase the availability of vaccines to developing countries, potentially breaking a year-long global deadlock on the topic. The two have been on either side of the debate at the World Trade Organization, with South Africa championing a waiver of intellectual property rights and the European Union resisting and saying there is sufficient flexibility in existing rules. The World Trade Organization was to reach an agreement on global trade's response to the pandemic at its ministerial conference in Geneva from November 30 to December 3. European Commission official Antonio Fernandez told the Trade Committee of the European Parliament in a debate on the World Trade Organization that the European Union did not support a broad waiver of IP rights. And that's Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. To stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.